The call came just after 8 a.m. on a gray Monday morning. The Office of Inspector General had flagged suspicious billing patterns at Riverside Community Hospital, a mid-sized Ohio facility. The anomalies weren't minor, millions of dollars in. Medicare claims didn't match patient records. At the center of the storm was the hospital's billing department. Emily Carter, a veteran Department of Justice investigator, was assigned the case. She had uncovered fraud before: phantom patients, upcoding, inflated charges. But Riverside's numbers were extraordinary. Reports showed a surge in costly spinal injections and cardiac stress tests. Yet auditors found mismatches: patients billed for procedures they never received, or simple treatments coded as complex ones. Emily began discreetly, interviewing staff one by one. The billers were tense, cautious. Finally, one clerk admitted in a whisper that management pressured them to code higher or risk losing their jobs. That pointed suspicion toward Richard Hale, the department head. Richard had arrived 3 years earlier, earning praise for boosting hospital revenue. Under his leadership, profits soared, and so did questionable claims. Internal emails revealed his hand. He urged coders to optimize claims and maximize reimbursement. The wording was careful, but paired with the data, it exposed a deliberate scheme of upcoding and phantom billing. The question now was how far it reached. Did hospital executives know? Board minutes praised Richard's results but showed no concern for the sudden spike in revenue. Whether blind trust or silent approval, their oversight was lacking. Emily organized a surprise audit. Teams swept through Riverside, combing records, cross-checking claims, and speaking directly with patients. One elderly man, billed for multiple cardiac stress tests, was bewildered. "I never had that," he said. "I just came in to check my blood pressure." Piece by piece, the fraud unraveled. Richard Hale was arrested on charges of healthcare fraud, wire fraud, and conspiracy. Several supervisors were indicted for submitting false claims. Riverside agreed to repay $22 million and was placed under strict federal oversight. For Emily, it was another hard-won case. But as she finished her report, she reflected on the deeper cost. Fraud wasn't only about numbers, it was about trust. Patients relied on hospitals for care. Taxpayers relied on the system to safeguard public funds. Each false claim eroded both. The fraud was exposed, the perpetrators punished. But the damage to public confidence would take far longer to heal.